Hi, this is Dr. Ramin Tayani with the ophthalmology group of Tayani Institute. Maria Richardson, our surgery coordinator manager. If you are watching this video, you have been accepted to join our practice. Welcome. It's a great practice. We have multiple locations, multiple doctors. You'll probably see other videos to talk about how the Institute is set up, and this is to help you have a quick little glimpse of various departments. And right now today we're going to talk about your department, Maria, which is the surgery coordinating department. Do you want to tell us a little bit about how it's set up and what you guys do, etc.?
Sure.
Okay.
Welcome aboard. My department is the surgery scheduling department. We have a couple of us in the department, and we have a doctor for each of us. When the doctor sees a patient and they become a surgical candidate, then they consult with one of us. And we take them through the entire surgical process, which starts with getting an authorization, sending the patient to their primary care doctor to get a clearance. We walk them through what to expect, the process of the surgery. We take them up to surgery day. We prescribe their medications. We go over their post-op care. And we walk them through to the surgery day. If any questions that they have, we answer them for them. And then even afterwards, if they have questions with their post-op care or issues, then they will give us a call. So we just basically take care of the patient from the time they start their surgical process to the end. We take all of their phone calls through our direct number. We also provide charts to the various surgery centers that we go to, that the surgeons go to. We prepare those charts, and we just work closely with the surgery centers that we have.
Yeah, that's great. You guys also do the financial discussions too, right? You do
We do.
All the cash and also the insurance component?
We do. If they have a insurance, we check with their insurance company to see if they have any kind of a copay or deductible, and we let them know about that prior to the surgery. And then if there is a cosmetic component to it, we do discuss the cost of the cosmetic components, and we collect that money prior to the surgery being done, generally a week prior. And so we have that discussion with them so they feel comfortable going into surgery day.
Yeah, so we use the word cosmetic, but also cash things. Sometimes if it's upgraded premium lenses, you guys will learn about that. We have options for upgrading in our cataract surgery world. Sometimes patients come in for a functional eyelid work, but then there's a cosmetic component.
Correct.
So any basically cash component, the surgery coordinators do work with the patients to either collect it, cash, credit card, check, and then we also have Care Credit. Do you want to talk about Care Credit a little bit?
Care Credit it's an excellent credit card. It's only can be used for medical purposes. So dental offices, surgeries, veterinarian, various medical purposes. And we do take that credit card and we can offer various different promotions, one of which is a 24-month deferred interest, 12 months deferred interest, depending on the dollar amount of the surgery. So we do offer Care Credit. It's a great credit card to have on hand.
You said deferred interest. Isn't it interest free if they make their payments within that period of time, whether it's a year or 2 years?
Well, the reason they call it deferred interest is because if the patient does not follow the agreement, they will pay the interest on the entire dollar amount. So there are certain criteria that they have to meet within the 12 months or 24 months period. And if they meet that, then it is interest free.
Yeah. So we encourage them to do that so they don't incur interest, because if they do, that interest rate is extremely high, but they can have actually the whole program done with no interest at all.
Exactly.
What other things? We should talk about the phones. So you guys prefer, if you're watching this, you're not in the department of surgery scheduling, so this is sort of an overview. If you're in the scheduling department and you're going to try to find one of the surgery coordinators, they have common phone numbers that ring in all of their phones. It's called a virtual number. I forget, is it 1170? No.
No.
What's your? I can't
don't
remember either. Yeah, so you'll have that access in one of the videos. It'll talk about the phones and the phone tree and everything. But there is a phone number that rings several of the desks where the surgery coordinators are sitting. You guys are primarily in which offices?
Most of the time we're in either San Clemente or the Mission Viejo office, but there are times that we travel with the surgeon that we work closely with, so we're in different locations. We all have a direct number, and we do give that to our patients so that they don't have to call to the scheduling department. They can call us directly and leave us a voicemail. We also have our own emails that we also give out to the patients as well. So that they can directly.
Like that, right? You like the email communication, so if another staff member is taking a phone call, they can either forward the call to your voicemail, or you like actually email communication.
Yeah, email is great way to communicate with us, because if we're not in our office to hear the phone ring, we can see our email because it pops. We have our email open all the time and it pops up right away. So it's actually a faster way to get in touch with us if we're not sitting at our desk. Or we may be on the phone with an insurance company or a patient, and you can send us an email and we see it right away. So we do prefer the email.
Mm-hmm. So welcome aboard, and this was just a quick synopsis of the surgery coordinating department, surgery scheduling department. Mm-hmm. People use the various terms for it, patient coordinators, etc. There are several other videos that you'll be watching, and if there's any questions, please reach out to any of the managers. Welcome.
Welcome. Thank you.
Bye.